Today I'm seeing this beautiful patient here for revision plastic surgery.
I went in to have some implants put in, scar tissue removed, and to have a breast lift. As a result, I had some complications that set in and the nipple became necrotic. So I've lost both the right nipple and areola.
Yeah. But then later you found that was not even board certified, right?
Correct.
And was not a plastic surgeon either.
Correct.
Obviously, this is a sensitive subject, but a subject that is important for people to realize, because somebody says, I am a plastic surgeon, or somebody says, Dr. Smith, plastic surgery office, go to this guy, he's a wonderful plastic surgeon. It doesn't mean that you guys should not do your due diligence. Always look and make sure that the person you're going to is truly board certified in plastic surgery, not board certified in liposuction surgery or aesthetic medicine or other disciplines. They have to be a plastic surgeon. They have to be a member of the American Society of Plastic Surgeons. If you are a member of the American Society of Plastic Surgeons, you're board certified in plastic surgery. And your board certification has to be in plastic surgery, not in other boards. And there are other boards out there. There are a lot of misleading boards out there that people don't realize that these people are not plastic surgeons. There are boards that sound like plastic surgery, but they're not plastic surgery, and they don't have the same 6 years of rigorous training in plastic and reconstructive surgery. You have to be your own advocate. And unfortunately, we all can make mistake and trust our friends or our physicians and end up needing a revision. Even in the best hands, complication can happen. But apart from what has happened to her, what you'll see is that this implant is much lower than this implant, and you can see the implants really look. This pocket goes all the way almost to her clavicle. So the pocket is really big here. There is no cleavage. The implant moves all the way to the armpit and it's very low. And ideally, it shouldn't be like this. To correct this would take closing the pocket here, revising her inframammary crease so it's tight, so the implant has a shelf to sit on, closing the lateral pocket, the outer pocket, so the implant can now sit more towards the center, and then closing the upper pocket so the implant doesn't go all the way up there. So it's a big surgery. Other ways of correction in my practice would be using or borrowing tissue from adjacent areas. I would use her mid-back roll. Instead, I think that would give her a much nicer result. If she desires, we can do an incision on her back, what we call a bra line upper body lift, bring that fat forward and flip it and do a spiral flap, a procedure that Dr. Hurwitz and I described in 2008. We can reconstruct her inframammary crease, make it tight and nice. We can do a reverse tummy tuck at the same time. We can narrow the width of the breast and position the breast unit itself higher on her chest. So there is a lot we can do. Or if she decides to have implants, we can replace the implant. But then again, this pocket has to be 100% modified and corrected.